Hi there. We're hospital pharmacists from the General Hospital St-Lucas in Ghent. Tag along today.
We are hospital pharmacists. Of course, we dispense medication for our patients. While multitasking. Just 1 second, please. Hospital pharmacy?
This pharmacist is working in the beating heart of the hospital pharmacy, drug distribution. We answer phone calls and questions regarding immediate inpatient drug orders, drug deliveries, and stock issues while multitasking. Another subunit of our responsibilities is the distribution of medication, even for outpatients who need specific molecules. With an increasing number of back orders, we're constantly looking for appropriate substitutes and searching for the best option, even when this implies ordering a non-formulary drug. Last but not least, our accountability to monitor the stock and use of narcotics in the entire hospital. These are the key assignments of drug distribution.
We're hospital pharmacists. Of course, we check the appropriateness of every new prescription.
We check for duplicate drugs, maximum dose, stability, and compatibility using the gate list and other scientific sources. We substitute originally prescribed drugs to a formulary drug if possible. We check whether medication can be crushed. Let's see what's happening in the clean room.
We're a hospital pharmacist. We are responsible for preparation of chemotherapy in our clean room, and of course, we look fashionable while doing it.
Before the chemotherapy is prepared, the hospital pharmacist checks the dosage, the interval with the previous cycle, and important patient characteristics on the prescription. The dispatching pharmaceutical assistant takes everything needed and passes the required materials onto another assistant at a laminar flow cabinet. This assistant safely prepares the chemotherapy while accounting risk of contamination. The hospital pharmacist checks name of the patient, molecule, volume, and diluent via camera. The dispatching assistant will double-check the recipient. Then, the chemotherapy will be transported to the correct nursing unit through our system of pneumatic tubes. Molecules in clinical trials may also be prepared in the clean room. But how does a clinical trial affect an everyday pharmacist's schedule?
We are hospital pharmacists. We are responsible for clinical trials and we have to document everything.
When a physician in the hospital wants to participate in a clinical trial, we have to train ourselves and colleagues regarding the new protocol. We schedule the initial clinical research associates visit and other follow-up visits. According to the protocol of a clinical trial, internal procedures will be drafted by the hospital pharmacist. We ensure the correct storage, dispensing, preparation, and administration of drugs within the clinical trial. In addition, deliveries of medical samples are meticulously controlled. To be able to continue to conduct clinical trials, we have to maintain our Good Clinical Practices certificate.
Yes, Admiral is a good alternative. Okay, have a nice day. Bye. We're hospital pharmacists. Of course, we provide clinical information.
A clinical pharmacist answers phone calls and questions from physicians and nurses requiring clinical drug information. We perform medication reviews for geriatric patients using the stop-start criteria. At any time, a physician can ask a pharmacist to perform an interaction check for inpatients. We review medication reconciliation carried out by our pharmaceutical technicians for patient admitted via the emergency room.
We're hospital pharmacists. Of course, we are responsible for pharmaceutical preparations.
We validate sterile and non-sterile pharmaceutical preparations after post-process quality controls. We carry out in-process and post-process controls during the unit dose repackaging in the hospital pharmacy. We answer questions and phone calls from the FTAs, nurses, physicians about pharmaceutical preparation and draft protocols to prepare them.
We're hospital pharmacists. Of course, we're responsible for the distribution of sterile medical materials and implants.
We keep an eye on the tracking board of the OR to make sure every implant needed is delivered on time. We communicate with physicians and representatives to ensure a good service. Thanks for joining us today at St. Lucas.